Hey guys, this is Dr. Hub. Today we are going to look at the duodenal ulcer. So how does this occur? So let's look at the outline. So there is the duodenal mucosa. So this duodenal mucosa, what happens is there is an increase in the acid load. So they may be resulting in the increase in the acid load, as well as there can be decrease in the mucosal defenses. There can be decrease in the mucosal defenses. So what does this ultimately leads to? This ultimately leads to ulcer. Now let's focus on how is the duodenal mucosa being affected. So firstly, it may be due to there is the increased rate of gastric emptying. So this can be a cause. Next is there is also the normal or increased gastric secretion. There is normal or increase in the gastric secretion, and this is postprandially and at rest. So this will be postprandially, as well as it can be at rest. Then comes an possible increase. There is a possible increase. So there is a possible increase. This will be in case of the parietal cell masses. In case of parietal cell masses. So then comes the effect of the H. pylori infection. So then comes the effect. This is going to be of the H. pylori. So in the video on the gastric ulcer also we discussed the H. pylori. Now let's recap here in duodenal. How is it specific? So in terms of the H. pylori effects, there is the bacteria. So what happens is the bacteria, it penetrates the cells. So it goes to the cells and weakens the mucin layer. So the mucosal layer will be weakened. Next is the bacteria. If you see the bacteria, it triggers the metaplastic changes. It triggers the metaplastic changes, and this is in the cells that support the bacterial invasion. So this is in cells which support bacterial invasion. So it triggers the metaplastic changes in cells which support the bacterial invasion. Next comes the cytokines. So this cytokines, it can cause the epithelial cell injury. That is an epithelial cell injury, as well as it can lead to the death. Then the cytokines, it also contributes to the, so let's write it down. The cytokines, it also causes the inflammatory changes. This will be in case of the mucosa. There is also a decrease in the bicarbonate secretion. There will also be decrease in the bicarbonate secretion, and there is also the protease which degrades the mucus. So the proteases, it degrades the mucus. So this was about the effect on the duodenal mucosa. So the duodenal mucosa, if you see, it was affected by all these causes which are mentioned, and then this duodenal mucosa, it leads to the increase in the acid load, as well as there's decrease in the mucosal deafness. So all this, what it does is it leads to the ulcer. So this was about the duodenal ulcer. We saw that the duodenal ulcer can lead to the increase in acid load or decrease in the mucosal defenses, and ultimately it leads to ulcer. And we also saw various factors which affect the duodenal mucosa. So to learn and grow daily like this, please do subscribe.